Leukemia is a cancer of the white blood cells. Your child's body needs white blood cells to help fight infections. There are two different types of white blood cell known as lymphocytes or lymphoid cells and myeloid cells. Normally, these cells repair and reproduce in an orderly and controlled way. In leukemia, however, the process of cell reproduction gets completely out of control and the cells continue to divide but don't mature. There are many different types of leukemia which can affect children and young people, including acute lymphoblastic leukemia, usually we call this ALL, acute myeloid leukemia or AML, chronic myeloid leukemia known as CML, and juvenile myelomonocytic leukemia known as JMML. Childhood leukemia develops quickly. It's possible for some or all of the symptoms of leukemia in children to be apparent. These are the ones to look out for. Paleness as a result of anemia, which leads to tiredness, unusual bleeding, unusual bruising, frequent and persistent infections, breathlessness, and coughing. A diagnosis of childhood leukemia is usually made on the basis of a blood test. This test will reveal low numbers of normal white blood cells and large numbers of the abnormal leukemia blood cells. Once this has happened and the doctors have the results, you'll be referred to hospital for further tests. A sample of bone marrow will be taken to confirm the exact diagnosis, and often a lumbar puncture is performed at the same time. The mainstay of treatment for leukemia is chemotherapy. During chemotherapy, combinations of chemotherapy drugs and sometimes steroid medicines are given in several stages or blocks of treatment. As well as chemotherapy, some children with high-risk disease will also need a bone marrow or stem cell transplant. The treatments used in childhood leukemia often cause side effects. Most side effects are temporary and can be minimized with good supportive care. However, some side effects can persist with long-term impact. The most common short-term side effects include nausea and vomiting, hair loss, reduced resistance to infection, bruising and bleeding, tiredness, and gut and nutritional symptoms. A number of children may develop persistent side effects as a result of treatment, sometimes many years later. These are known as late effects. These can include a reduction in normal bone growth, reduced fertility, a change in heart function, and a small increased risk of developing a second cancer later in life. Leukemia has one of the highest survival rates of all cancers affecting children. Until the 1960s, childhood leukemia was incurable. Today, thanks to improvements in care and sustained investment in research, the outlook for young patients diagnosed with leukemia has dramatically improved. The likelihood of a relapse progressively decreases with time. After 3 or 4 years, the chance of the disease coming back is extremely remote.